I want to go back to you trying to talk to Maria during this last segment we saw. Did you have an opportunity to look at Dr. Lewis's interview with the defendant, Ms. Stauch, in November of 2022?
Yes.
And did you see times where she was able to at least appear to have Maria come out and talk to her?
Yes.
Did you see any triggers, anything that she had to use to trigger some kind of traumatic event to have Maria come out?
It didn't appear that there was anything associated with a traumatic event during those particular interviews.
In one portion, does she appear to write something on a piece of paper, slide it over to Ms. Stauch, and then Ms. Stauch responds using her right arm, and then goes back and forth, and then she switches to using her left arm?
Yes, I do.
Then Maria somehow appears and she has a conversation with Maria, and Maria has a Spanish accent. Do you remember that?
I do.
Now, you didn't get an opportunity to go back to talk to Ms. Stauch after that evaluation, I take it?
Correct.
Anything about that interchange impact your opinion as to whether or not Ms. Stauch has dissociative identity disorder?
No.
Why?
In terms of dissociative identity disorder, we've talked about what it is and what the criteria is. And throughout this entire evaluation, we've always had concerns about potential feigning and exaggeration. The reason we have those concerns is because the things that Ms. Stauch talks about are symptoms that pretty much anybody who has watched movies or had some sort of access to television would know that this is what multiple personality disorder, dissociative identity disorder looks like in terms of speaking about amnesias, blackouts, different personalities. We've talked about how the typical presentation for a dissociative identity disorder tends to be more subtle, and at the same time, how someone would have seen something, someone who was close to Ms. Stauch. But there's no corroborating data from collateral interviews or even from the mental health record. Ms. Stauch talks about having this mental illness since she was 16 years old, and it's never repeated anywhere. Essentially, individuals who have genuine dissociative identity disorder do experience significant problems with their functioning. Usually it does rise to the level of needing some sort of psychiatric treatment, probably inpatient hospitalization. Those individuals are disturbed by what they are experiencing, and there's a quality to dissociative identity disorder that is involuntary, and it's not something that can be controlled, which is why it is disturbing to those individuals. They tend to be overwhelmed by the symptoms that they are experiencing. In addition to that, they tend to be ashamed about their experiences. So there's a tendency for them to essentially try to withhold some information, maybe minimize that information. They don't want to readily put it out there for people to know I have dissociative identity disorder. They don't enjoy having this condition. And Ms. Stauch's presentation in our interviews would suggest otherwise. One of the most striking components to me is that she doesn't particularly seem to be disturbed by having all of these personalities ending up in different states or different countries. And that's meaningful to me. So taken together, the lack of substantiating information outside of Ms. Stauch's self-report is not enough for me to be convinced that she actually has this illness.
And did you consult with Dr. Gray about the reasons why you felt it wasn't there?
Yes.
Does he agree with your conclusions?
He does.
And I'm not going to ask you about that again when we go forward, but did you have enough information to rule it out, to not even consider it as a rule out in your diagnosis?
We felt that we had enough to substantiate that this is not what was going on with Ms. Stauch.
And even though another forensic psychiatrist, Dr. Lewis, wrote a report saying she does have this. She diagnosed Ms. Stauch with that disorder. Anything about her report or the interview that you reviewed change your and Dr. Gray's opinion?
No. Again, looking at the timeline of everything, considering the fact that we saw Ms. Stauch in 2020 for the competency evaluations, her presentation then, her presentation when we saw her for the sanity interviews, we noted that this claim of dissociative identity disorder and the symptoms that she was proposing, they change and they seem to increase over the course of the 2 years from the time of the offense to the time that we saw her and even to the time that she was seen by Dr. Lewis.